Good day, especially to our clinical instructor, Mrs. Erlina Cruz. Now, I will show you on how to perform Leopold's maneuver and the step-by-step procedures. Leopold's maneuver are four deeper palpation technique that the examiner will determine the presentation and position of the fetus and aid in location of fetal heart sounds. Let's begin.
Hola, I'm Mae SC Cruz Silvestre, your student nurse for today. So now, we will perform a LEOPOLD'S maneuver, which we need to provide a client's privacy. Do hand washing, and of course, identify the correct patient. So let's go! Good morning, ma'am. I will do a LEOPOLD'S maneuver, which I will determine the position of the baby in your stomach. That's okay, ma'am? Okay, let's go.
First maneuver is the bundle grip. This maneuver is to help to determine the situation of the infant, whether it is longitudinal, transverse, or oblique. It will identify the fetal pool in which the uterine fundus is located. The first step is to base the client's head and expose the part to be examined, keeping a cover on the other parts. Privacy is a must. The second step, using both hands, palpate the pundal area. Expect to palpate a soft, irregular mass and wedge located in the upper quadrant of the maternal abdomen. The rationale to this maneuver is to determine the shape, size, mobility, and consistency of what he or she feels. The limbs and shoulders contains little bone processes that move with the fetus trunk. The head is firm, hard, round, and moves separately from the trunk, and the buttocks is symmetric and feels soft. The second maneuver is the umbilical grip. This maneuver is to help the examiner determine the position of the infant, whether it is right back or left back, and etc. In the third step, while still facing the patient, move hands to the lateral side of the abdomen. Perform this maneuver by placing the right hand on one side of the patient's abdomen while using the left hand to explore the woman's uterus on the right side. Fourth step, repeat this step on the opposite side using the opposite hand. The rationale to this maneuver, wherein the fetal back is smooth and firm, the extremities of the fetus should feel like protrusions and small irregularities. And the third maneuver is the Pollex grip. It is for fetal presentation, whether it is cephalic, pedialical, meaning pit first, pulvineal, and meaning birch, so that I will place my hands on the presenting part nearest the vagina to help determine presentation and to determine the height of presentation, whether you're pretty high up in the abdomen or if the fetus has descended and it is starting to engage and be ready for the delivery. The fifth step, you're going to form your hands into an L shape and move hands down to the lower pelvic area. And the sixth step, palpate the area just above the symphysis pubis to determine the presenting part. And the seventh step, grasp the presenting part with the thumb and fingers of the right hand. The rationale to this maneuver is to identify the part of the fetus that is above the inlet. At last but not least, probably the most well-known of the four LEOPOLD'S maneuver is the pelvic grip. As this implies, it allows to verify the degree of fit of the presentation of the fetus in the maternal pelvis. The eighth step is to base the client's pit. And the ninth step is place your hands on the abdomen and point fingers towards the mother's pit. And for the 10th step, Gently move the fingers on both hands towards the pubis by sliding the hands over the sides of the patient's uterus. And the rationale for the port maneuver is the side where the greatest resistance to the descending fingers is the location of the brow. Record your findings on the client's record and report your findings to your clinical instructor and to the attending physician. That's it!